are in listen-only mode.
Hello and welcome to County Health Rankings and Roadmaps 101 webinar, including a tour of our website. My name is Mary Bennett and I'm a community coach with County Health Rankings and Roadmaps. Today I'm pleased to be joined by my colleagues Justin Rivas and Erica Burrows-Girardi.
Hi everyone, this is Justin. I'm glad to be here with you this afternoon.
Hi everyone, this is Erica Burrows-Girardi. Happy to be with you.
As we go through this presentation, we'll be taking turns answering your questions as well as sending out links via the chat box. And also slides for today's webinar are available in the handout section, which I'll talk about in just a moment. So the County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We'd also like to acknowledge that this program is the result of the contributions of many colleagues and partners in Wisconsin and all across the nation. Thanks to their support, we're able to bring you this webinar today. Next, we want to make sure and take a moment to get you oriented to the technology we're using. The GoToWebinar attendee interface is made up of two parts. On the left here, you can see the viewer window where we'll see our screen throughout the presentation. On the right, you can see the control panel. Here, you'll find handouts for today's session, including the PDF of our slides and a list of related links we'll be sharing during the presentation. You can also interact with us through the control panel by using the questions section. Please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout our webinar today. We'll be sure and leave time for your questions. Today we'll cover an overview of County Health Rankings and Roadmaps, share the 2017 rankings release date, provide a live tour of our website, demonstrate how you can access additional tools and resources, and spend a little bit of time answering your questions. Now it's my pleasure to turn this presentation over to Justin Rivas.
Hi again everyone. So I wanted to get started with a guiding question today. How can County Health Rankings and Roadmaps help you build a culture of health in your community? The Robert Wood Johnson Foundation has laid out a powerful vision for building a culture of health in every community in the country. That vision includes the belief that all individuals and families should have the means and the opportunity to make choices that lead to healthy lifestyles, regardless of where they live. Not long ago, America viewed health as the doctor's office, somewhat isolated from daily life. But today we know better, and research gives us a better understanding of how connected health is with income, education, housing, and a myriad of other factors. There's a tremendous need to shift from the old lens of working in silos, since we are finding that only a cross-sector approach can fully address these intertwined and complex issues. Each one of us is a piece of the puzzle of building a culture of health. The hope and vision of a culture of health has to be shared, and the circle of engagement needs to extend to the whole community. The truth is, everyone has a stake in the health of our communities, from families to schools to businesses. In the same way, the County Health Rankings and Roadmaps program is made up of many components that work together with a common purpose to build a culture of health, county by county. So let's think about why this work is so important. Another way to think about a culture of health is where everyone in the community has equal opportunity to enjoy good health. In other words, health equity. You may be asking, how can we assure that our work is creating a health for all? Or how can we move beyond a health equity lens to applying equity as a strategy? Or what does health equity really mean within building a culture of health? It means creating a sense of community where all individuals, especially those most affected by poor health outcomes, feel they have a voice and a role to play in creating and implementing solutions. Healthy People 2020 states, achieving health equity requires, quote, valuing everyone equally, with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. So let's take a moment to break this down with a few examples of policies that have led to some current inequities. So first we'll look at housing. Here in a few minutes when we review the rankings model, you'll notice that housing and transit are included as a focus area. So why is this relevant? Well, access to affordable housing is key to good health. Generations ago, during President Franklin Roosevelt's New Deal, the federal government started subsidizing a lot of housing, but they funded programs that allowed whites to move into new suburbs like Levittown, New York, while the options for people of color were public housing apartments in the same city centers where they already lived. Over the generations, the suburban homes greatly increased in value, creating wealth for the white families there. Meanwhile, even though laws have changed, allowing people of color to have the right to buy into places like Levittown, many of these homes are now selling for over $500,000, which is out of the range for most and many people. For a second example, we'll explore the wage gap between men and women. With a history of women being excluded in the workplace and women's jobs being differently valued than men's, there's a long-standing income disparity between women and men. This image from 2012 shows women earning just 77 cents for every dollar men earn. And as of last year, women still were only making 79 cents for every dollar men earn. This gap has a significant effect and impact on families. So as you reflect on your work, we invite you to consider how you might work with those who are most vulnerable in your communities to identify what changes are needed to improve health equity. I encourage you to check out a few of the links that hopefully Eric is sharing right now. One to our Health Gaps report and to other tools and inspiring stories on how to truly address health inequities. So now that we've discussed why this work is important, let's review the county health rankings. And as we share the various components that make up county health rankings and roadmaps, I would invite you to think about what piece or pieces of this program you can use in your work as you see it. So before we get into an explanation of the rankings, we wanted to share that the annual rankings release date has officially been set, and it is March 29th, 2017. We work with state teams in all 50 states to prepare for any and all inquiries related to the newly released rankings each year. So this slide shows the thinking behind our rankings, or our theory of change about how rankings can be a catalyst for action that improves the health of everyone in a community. Starting on the left, we take population-based data that is collected by others, and we utilize this data to create an easy-to-use snapshot that compares counties within each state and is released every spring. But we produce the rankings for a reason, because they get attention of media and can be used to start to broaden conversations about health in communities. Those conversations can then lead to broad community engagement and multi-sector partnerships that can in turn select and implement evidence-informed strategies to address community priorities and finally, in the long run, improve health outcomes. So essentially, the county health rankings aren't just about numbers, but they're really mostly about a call to action. And we also know that while this maybe seems simple in theory, putting this model into practice is quite challenging often. So we provide tools to assist communities in each area, and we'll talk more about those in just a bit. So next we'll look at the rankings model. And the rankings model is one of the most important images we'll share with you today because it shows what we use to determine the county health rankings and what influences health in a community. The model shows the relationship between policy, health factors, and health outcomes. The rankings make it clear that good health includes many factors beyond medical care, including, as we discussed, housing, education, jobs, access to healthy food, and many more. It shows us that all these factors impact how well and how long we can live. So starting from the bottom, we know from research that effective local, state, and federal policies and programs can improve a variety of factors that, in turn, shape the health of our communities. And that many health factors, and these are the blue boxes in the model, shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. And you'll see that each of these health factors are on a weighted scale. We measured two types of health outcomes, and these would be the green boxes across the top of the model, to show how healthy each county is. And these are length of life and quality of life, and then further broken down into other measures. So let's translate this theoretical model into a real-life example. Expanding early childhood education improves academic achievement. Higher levels of education lead to higher levels of income, which make it easier to access healthier foods, clinical care, and quality housing, which in turn can influence health outcomes. So you can see that there are multiple factors that shape health outcomes. So soon Mary will be doing a web tour in a few minutes, and she will show you more about the rankings, specifically how to find and use the snapshot of health data for your county. Now we'll continue the overview. Our next stop is the Roadmaps to Health area, and that's really the how-to of the county health rankings and roadmaps. So right now you're looking at a screenshot of our Roadmaps to Health Action Center. And the Action Center includes people, tools, and practical resources to guide communities as they build healthy places for all to live, learn, work, and play. So now I'm going to take a chance to launch a poll to bring everyone else, including all the attendees, into the room and give you, the viewers, an opportunity to participate in today's webinar. So we're going to send out a poll, and I'll launch it right now. That's basically just going to assess and gauge how familiar our attendees are with the Roadmaps to Health Center. So it should be showing up. A question of how familiar you are to the Roadmaps to Health Action Center. And let's see, are you seeing it, Mary? Okay. Let's just make sure. Great. And looks like everyone's starting to fill it in. And we are doing pretty well here. 70% voted. 70, almost 75%. I'm going to shoot for 80%. Let's see if we can get there, guys. Just about. All right, that's good enough for me. So I'm going to take the chance now to close the poll and hopefully share with everyone. So now you should be seeing the results of the poll, and it looks like about a quarter of you have never heard of it, and it looks like almost half of you that have responded have heard of it but not used it, and another quarter have heard of it and maybe used it a few times, and very, very few of you are very comfortable using it. So that's great. It supports our actions here to move forward and talk about it. We'll move on to the next slide, and we'll dive a little deeper. As we continue to explore the how-to of county health rankings and roadmaps, I want to share with you the Take Action Cycle. So the Take Action Cycle and all of its resources provide step-by-step guidance to support your work. Communities can and are improving health by using these steps of the cycle. So we'll do just a very brief overview. Let's take a second and walk through the steps of the Take Action Cycle, starting at the top right. First, you want to gather information to assess needs and resources in your community. Then, set priorities so you can focus on really what's important. Next, find the most effective strategies and approaches for your community to address your priorities. And then, get to work. Get to work on acting on what's important. And of course, evaluating throughout the entire cycle will help you improve your strategies and ensure that what you're doing is effective. You'll see that the communicate and work together surround the entire cycle, because working together and communicating with partners, policymakers, and your community is continuous throughout all steps. At the heart of the Take Action Cycle is the people working together, or the community, because we know solving issues like childhood obesity, poor high school graduation rates, or crime and recidivism require the wisdom and resources of everyone in the community. So next you'll see, and here's another very helpful resource I want to highlight, which is called What Works for Health. And What Works for Health provides communities with information to help select and implement evidence-informed policies, programs, and system changes that will improve the variety of factors we know affect health. It is found online in the Roadmaps to Health section of our webpage, and Mary will show you how to access What Works for Health during our live web tour. So now we're going to try and launch a second poll. It's actually the exact same responses, just a different question asking everyone's familiarity with What Works for Health. So I'm going to go ahead and get that going. And hopefully that has popped up on your screens. And if you could go ahead and mark your answers. And wow, already 50%. Some very, very skilled users in the room. That's great. Cool. 65, and just about 75%. Let's get above 80. I know we can do it this time. I have confidence in everyone. All right. Great. That is good enough for me. So I'm going to close the poll. And we'll share responses here. Okay, so this is a very typical trend. It seems like far more people are not familiar with What Works for Health. A few have heard of it but not used it, and even fewer have heard of it and maybe used it a few times. So that makes me excited to be able to share it. So let's go ahead and do that. So many communities are working in the choose step of the action cycle that I just showed, and that's where What Works for Health really exists. But it can also help you assess the current strategies and better understand expected outcomes when you're taking action. So broadly, What Works for Health is a menu of evidence-informed ideas containing over 380 strategies and counting. And by strategies, I mean ideas for policy, programs, systems, and environmental changes. And by counting, I really want to emphasize that What Works for Health is a living resource that is updated routinely to share new evidence and findings that reflect shifts in the literature, but also to share innovative and emergent ideas. For example, just this week, we added 2 more strategies on lead pipe replacement and lead-contaminated soil abatement. One of the things that I really like about What Works for Health is that it provides an easy-to-use searchable menu to help you look for evidence-informed policies and programs that are specific to the problem that you're addressing. It is also an all-in-one place where you can find evidence ratings, short lit summaries that highlight the who the strategy can benefit, the what of what it can do, and as we have it, some information about cost. We also include disparity ratings, again, for the policies and programs where we have evidence to support it, to help communities use an equity lens as they explore these strategies. And there's also a list of implementation resources to help move from ideas to action. And if you need support in moving from ideas to action, our community coaches, which are at no cost to you, are an excellent resource. So, when I introduced the Action Center a couple slides ago, I mentioned that it does include people, and it does indeed. Here are all of our coaches who are strategically placed around the country from areas like California, Colorado, Pennsylvania, Florida, South Carolina. There's a photo. This is a photo from October 2016 when we all got to get together, all 11 of us, in Madison, Wisconsin. You can easily reach out to community coaches by clicking on the Get Help buttons that you'll see throughout the website, which will lead directly via email to any one of us. So not only are our coaches active nationwide, but here's a map of our comprehensive work across the country. That's including active coaching teams, prize communities, and presentations and conferences that we attend. So before Mary begins the web tour, I wanted to highlight some key takeaways. So far, we have discussed why this work is important, reviewed the rankings model that shows what we use to determine the county health rankings and what influences health in a community. And we touched on roadmaps to health, which again is the how-to for moving from data to action. Let's take a second to tie together the why, what, and how of county health rankings and roadmaps. It takes everyone, all of us working together, to improve the health of a community. We need to move as quickly as possible from data to action, not get stuck in analysis paralysis or drowning in the data. We encourage communities to look to evidence to inform these actions, and if you innovate, be sure to evaluate. Keep focused across the health factors, including definitely social and economic factors. Prioritize your efforts to focus on creating better opportunities for health of all community members, especially those who aren't as healthy as others. And don't be afraid to take on policy, systems, and environmental change, which will, in the long run, create the greatest long-term change in health for the children and adults in your communities. So having walked through the overview of county health rankings and roadmaps, I'm going to give Mary some time to switch your screen here, and we're going to transition to the web tour. I'm going to take the turn now to hand it over to my colleague, Mary Bennett, and she'll begin the web tour and carry on our discussion.
So hello again. So we're going to begin with the countyhealthrankings.org homepage. We'll give you some tips on how to navigate around the site and where to find different resources and tools, many of which Justin has mentioned, to support your local improvement efforts. So starting with the navigation bar, the top of the page, this navigation bar remains at the top of the page throughout the site. It's a great way to navigate around the full site with just a few clicks. So no matter where you're on the website, you can always scroll up and click on the County Health Rankings logo here to return you to the home page. So back to under the Rankings tab, you can see here, you'll find information about our approach, about the rankings methods, and measuring progress, as well as tools to help you understand how to use your data. Next, you'll see the Roadmaps to Health tab, where you can access the Roadmaps to Health Action Center, What Works for Health, and also view stories of communities taking action. You can also learn more about community coaching if your community could use some guidance or a thought partner as you work to improve health. Under the Resource tab, you'll find reports, including your state Health Gaps report and the Key Findings report from the past 3 years. Also information about upcoming webinars, as well as FAQs. Under the More menu, there's a link to the county blog, County by County blog, the About page, where you'll find more information about our program, including publications, as well as the Robert Wood Johnson Foundation Culture of Health Prize. You'll find information on past and current prize winners, including their stories, and they're just wonderful videos which you can view about each community. You can also learn more about how you can apply for the Robert Wood Johnson Foundation Culture of Health Prize. In the middle of the page here, you'll find a map of the United States, and you'll see that where you can highlight a state, you can also here go to the search menu to put in your state or your community. So today, to begin our exploring of the rankings, we're going to click on the map and we're going to go to Kentucky, the home of a Robert Wood Johnson Foundation Prize, and specifically in Louisville, Kentucky, which is Jefferson County. So you can find this either by select a county or you can click on the map. So I'm going to just quickly show you how it scrolls down and you can find it there, but I'll click here on the map because I know where it is. Oops, actually, you know what? I'm going to go back one click here, because I just realized before I show you your county snapshot, I want to show you your state page. So this is the Kentucky State page. And here you see the green map for health outcomes and the blue map for health factors. And just below the maps, you see the state health Gaps Report for your state and another source for data for your state and local communities. You can download this report to find out what's driving the health differences across your state and what can be done to close that gaps. From this page, further scrolling down, you see you can download data and additional resources. This is an opportunity to see if your state offers more sub-data and different demographic levels, and also going further down, you can find stories from your state. You can find information about community health improvement resources in Kentucky, as well as your state contact. So now let's go up to the top of the page and take you to where I went before, to the specific county of Jefferson. And this is what we call the County Health Rankings Snapshot. And our fabulous data team has really constructed this so in a way that you have easy access to the information and aren't overwhelmed by the data, but you can always dig deeper to find out more information. So across the top of your snapshot, you see some tabs, and these offer ways to explore your data. You can use these tabs to explore measures, get downloads, and compare multiple counties. A new feature last year is the ability to compare counties not only within the state, but across. So now let's look at the actual snapshot here. So before we jump into the data, we want you first to understand what the data is measuring. So in the first column here, I'll scroll down and you can see there's 35 measures that we use to calculate a county's rank. But you might wonder what exactly the measure is examining. You can learn more about each of our measures by clicking on the Measures tab, or by clicking on the measure name, where you'll get just a short description of the measure. So I'm going to scroll down for a minute here, and let's look at physical inactivity. Here, the short version, it's the percentage of adults age 20 and over reporting no leisure time physical activity. But when we click on this, takes a moment to load, you see here there's a lot more information. You can see the map above the counties that with higher levels of inactivities or deeper blue, and counties with fewer and lighter blue. And you'll also again notice a few tabs here where you can dig deeper. From these tabs you can look more about the data for this measure, see a full description including why we use this measure, learn about the data source, and begin to browse relevant evidence-informed policies and programs in What Works for Health. To the left, you'll notice there's a brief description, a bit about the rankings methodology, and summary information for this measure. Now that we understand the measures, let's look at the data. So I'm going to head back to the snapshot here, and we're going to look at the data. So as I said, there are 35 measures we use to produce the county rankings. So now that you look at these, you can compare your county value to the state. So here we see Jefferson County's data, but you can compare it because over here you see you can compare it to your state value. Are you better or worse or about the same? Are you doing well? and better than the state average. You might also want to look at the top performers value. This is the value for the 90th percentile or the top 10% of counties in the U.S. It's more of an aspirational number and can be something to reach for if you aren't there yet. Finally, for some of our measures, as you can see here, we provide trend graphs. This snapshot is just that, a picture of your county's health during a specific point in time. The trend graph allows you to see changes that have occurred for that measure over time. You can see a detailed graph of a trend data by clicking the graph icon, and I'm going to go back to physical inactivity here. And we have a color-coded on each icon to help you quickly see whether your county's estimate is increasing, decreasing, or staying the same over time. The red graph icon indicates your county is getting worse for this measure, yellow if indicate your county is staying the same, and green is getting better. So here on physical activity, you'll see the county's trend is in blue, the state's in green, and the national in orange. So you can see that in this state that there is a leveling out right now in all three of those categories. So once you've explored and compared your data, you might have a good sense of what's going on in your county and what areas are in need of more work. But if you're still looking for a little further guidance in this area, then we'll scroll up to where you see here there's areas to explore where possibly there are challenges and areas of strength. So areas to explore highlights potential challenges a community may want to examine more closely. So when you turn it on, the orange boxes will highlight the areas to explore based on health factor measures that seem to have the greatest opportunity for improvement. Areas of strength will be highlighted, click on it here, in purple and show areas where a county is doing well relative to either other counties in your state or across the U.S. Additionally, I want to point out this how additional health outcome measures, which provides additional data that may be useful to you but is not used to calculate the rankings. You'll notice that this year they are embedded in the snapshot and you can click them on and off just as I have done here. Once you've taken some time to explore and understand your snapshot data, you may want to dive a little deeper to better understand health in your community. Part of diving deeper is to gain a deeper understanding of who in your county is most affected by factors that contribute to poor health. Who's using tobacco? Who isn't succeeding in the educational system? Who's unable to access safe and affordable housing? To help with this, we've included some tools on our site to help you understand your rankings data and how to think about how you can measure your county's progress over time. So I'm going to return here to the navigation bar at the top of the page, and you can see the rankings menu, as we saw before, to get to the using rankings data and the measuring progress. So using rankings data, here we are, helps you find and understand the data on our site and beyond as you begin to assess your needs and resource and focus on what's important. It includes Digging Deeper, which helps you think through what other information would help you further understand the health differences between subgroups in your community. Going back here, you also, in terms of finding more data, directs you to additional, it's right here, finding more data directs you to additional national and state data resources. I also encourage you to look at the measuring progress found in the same area. This tool helps you understand how to use ranking measures to measure your progress, where to look for other data that can help you tell your community story, and how to tell if your community is poised for progress, building a culture of health. So we've explored the data. Go back here. There we go. We've explored our data, and now we're ready to do something about it. We're ready to take action. So from the navigation bar, I'm clicking on the Roadmaps to Health in the menu, and here you see the Action Center. The Action Center includes a guide. Here we are. A guide which describes, sorry about that, getting to the guide here. Again, as Justin says, he showed you all the steps along the path to building a culture of health in your community. And you can see that the image is interactive, and you can click on each of the steps or any of the partner circles in the center. You'll see some of the questions that come up in which the guide addresses. This allows you to understand the different steps before actually diving into the guides. There's also a navigation bar on the left here which shows you the action steps where you can get more information, and the partner guides. So let's take a look at one of the guides. So I'm going to click on Work Together. Here you find a brief description of the step, the purpose, who to involve, and scrolling down you see key activities. So you can find the most relevant, sorry about that, guidance and tools for where you are in this step. When you find an activity that is of interest to you, you can open it to read the guidance and explore links to related tools. Here you see that this year we added the key activity focusing on working together towards equities or addressing inequities. So I'm going to click here so that you can just get a sense of what you find. Each activity includes tools to help communities work through that part of the process. You will always see 5 tools visible. You can explore those, or you can open up to view all tools, which you see here. You can look at communities in action, stories scattered throughout the Action Center, and what works for health, because they provide an example of programs, policies, and tools. All right. So going back to Work Together, and you can see I'm clicking here. You can also see, or on the Action Center site, you can see there is always a Get Help box, which you'll find throughout the site, inviting you to contact our team for personalized free help. Clicking Get Help will take you to an email form that gets you to one of the 11 coaches based around the U.S. Now let's look at one more way you can find tools. We're going to go back up to the navigation bar and click on Resources. And then Tools and Resources. From here, as you see, you can look from the lists here, or you can go to the search resources and type in the specific topic that you're interested in. So now one question every community faces when taking action is what action to take. What intervention, what policy or program will be effective. We have a whole step in the take action cycle dedicated this, and we have one tool in particular which Justin talked some about, What Works for Health. And again, I went up to the orange menu bar and I'm clicking on What Works for Health. And as Justin said again, we have over 380 strategies we've rated for strength of evidence. So to learn more about strategies that can work in your community, you can select a factor of interest. So scrolling down, you can see once again our model and the light blue boxes on the right, which you can click in. Or you can also see the new updated policies and programs, so you can see the latest additions and updates to this part of the site. Each review strategy is assigned evidence rating based on quality, quantity, and the findings of relevant research. You'll find more about those ratings in our ratings on the left toolbar right here, or you can learn more when you go into a strategy. So let's just look for a minute at how you would find a strategy. So I'm going to click on the category of diet and exercise. Here you see there are 73 results. But you might say, oh, we want to look more specifically at healthy foods. So I've put healthy foods into the keyword search. Clicking on Go, I'm led to 53 results. And let's just quickly look here at new grocery stores in underserved areas. Here you can see the evidence rating, and if you need a reminder, here are the descriptions of the ratings. You also see expected outcomes, other potential beneficial outcomes, and evidence of effectiveness. So it's wonderful to have this resource of knowing who else is working on this and what is the evidence. We also, you can see here, impacts on disparities and implementation examples. So more ways to connect with others who are doing the same work. And implementation resources, which also can be helpful. And lastly, again, you can browse all programs and see what related programs and policies exist. So I'm going back to our home page, again reminding you, you can click on this icon to get back to the home page. And now that you have familiarity with our rankings on the website, the data, the roadmaps to health, how to take action, and the many other resources on the website, I'm going to turn it back to Justin.
Great. Well, thank you, Mary, for the fine tour. Next, I just wanted to cover a few more things before we get on to bringing everyone else back into the room for some questions. And I know that Mary covered the Culture of Health Prize, but I just wanted to introduce it a bit more. The prize recognizes communities that have placed a priority on health and are creating powerful partnerships and deep commitments that will enable everyone, especially those facing the greatest challenges, with the opportunity to live well. The 6 criteria displayed on the slide drive the selection of prize winners. We're looking for communities who are able to bring these criteria to life. The 2016-17 call for applications is currently closed and actually under review, but it is still a great time to think about how your community may meet these criteria and be a strong applicant for 2018. And just a heads up, the application window usually closes sometime in early November-ish. I'll just say that. And in case you're curious to see what recent winning communities look like, here are the 7 2016 winners. Louisville, Kentucky, Santa Monica, California, Miami-Dade County, Florida, Manchester, New Hampshire, Columbia Gorge region, which is Oregon and Washington, 24-1 community, which is in Missouri, and those are 24 connected municipalities in North St. Louis County area, and the Showalter Bay Indian tribe in Washington. I'm just going to make sure that Mary can catch up with me here on the slides. There we go. Cool. So there again are the 7 communities that I just went through, and we'll skip right on to the next slide. And then this map shows all past winners, with the 2016 prize winners I just mentioned labeled in the orange dots, and then the past winning communities from other years are shown in blue dots as well. So, moving forward, as you reflect on everything you've learned today, and as you move forward in your own community health improvement journey, working to create health for all, we invite you to focus on these 5 Ds. Differences. Investigate the differences, using Digger Deeper and other data tools to understand differences between groups of people in your community. Drivers. Focus on the drivers that most influence health, meaning policies, systems, and environmental conditions that create opportunities to improve health for all. Dig into the root causes. While all of the health factors affect health outcomes, be sure to focus on the social and economic factors as they contribute the most to poor health. Determine most effective strategies, as we just went through what works for health as an example, especially those strategies that, if directed toward those in greatest need, will reduce health disparities. And finally, do it. Harness the collective power of your community to take action that will create more equitable opportunities for good health for everyone in your community. So finally, we wanted to take the opportunity to open the discussion to all attendees to please go ahead and share some questions that you may have gathered at any point throughout our webinar this afternoon, or any burning questions you may have in general for us here at County Health Rankings and Roadmaps. And to get the discussion started, we were able to gather a few questions from the pre-registration that a lot of you kindly filled out when you signed up for the webinar. So I'll give Mary a chance actually to comb through those just a bit.
Thanks, Justin. So one of the questions that people are asking is, in counties where the data are generally positive, how do you address the inequities that are often beneath those positive findings?
That's actually a really good question, and I'll attempt to answer it in kind of 2 different ways, I think. So first of all, the health gaps reports that we brought up earlier and that Mary showed you the way to, that's a good way to kind of look at comparing how disparities are found in each county. But I also think this question is leading more towards asking about looking sub-county or below the county level in terms of data. And although there's some efforts that we're doing in this vein, characterizing that level of data in every county is kind of beyond our scope as of now. But again, that is something that we are working on looking into ways of developing. So if you're looking for that kind of more specific data in your county, and then at maybe a zip code level, look to local data resources, as you all know your county's best, and you're the best experts in those areas. Thanks for that great question.
Thanks, Justin. And we have another question related to rural areas and rankings and how to collect data in those areas, and how can you provide resources to these rural counties? We know that we have a full report from July 2016, but can you talk more about this, please?
Yeah, sure thing. So I was actually fortunate to just do another webinar, and it was a webinar short on this issue. And our webinar shorts, if you're not familiar, are just what they sound like, short webinars, 20 minutes, and they kind of just quickly get into an issue area. And this was on our rural report, which What Works for Health, the database we just looked at, did a specific report on rural areas and highlighted some ideas that are proven to be effective in those areas. And two of them, one maybe diet and exercise and specific programs like school breakfast programs, activity programs for older adults, and healthy food initiatives at food banks. And then another area they focused on was concerning healthcare. And specific strategies could be things like telemedicine or school dental programs or higher ed financial incentives for health professionals to serve and work in rural areas are a few examples. So I'm going to both share this PDF of this rural report in the handout shortly, and you can check back on that, and then we can also maybe be able to chat out a link to that report as well. But thanks, that's a really good question.
Thanks, Justin. Another question that has come up, and I've seen this several times, is can you talk some about moving your rank? And how can you help us understand better how you can do this?
Sure. That's a tough question, but it is one we do get frequently because let's be honest, we're all competitive, right? We want to see things improve. We want to see things get better. And a good quick answer is kind of to be patient about it, because we see that the process of evaluating progress in rankings definitely takes, it won't happen in one annual cycle. And also, if a county ranking has dropped, it's not necessarily bad overall, right, for the county. It's looking deeper, digging deeper into specifically which measures have dropped, and maybe looking at trend graphs over time to see why they've dropped. So thinking again that improving, we find that most counties actually stay within the same quartiles each year, so there's not huge jumps that are going to happen rapidly, small community change over time to improve health. So yeah, another really great question. So don't get caught up on the numbers moving slightly in short periods of time.
Thanks again, Justin. And I know that someone also had a question about would I need written permission from Robert Johnson Foundation or County Health Rankings or Roadmaps to use the data on a PhD dissertation or some publication. And I just want to be clear, data on our website is open to the public. So the purpose really of County Health Rankings and Roadmap is to provide the data and the how-to so that you can explore what needs to be done in your community to make your community healthier. And there are many ways to do that, whether it's someone, an academic working in this area or working with the community. So yes, we are pleased to say that our data is available for all.
And also, I just wanted to chime in on that same point that I think we covered it earlier, but if you look at the county health rankings and look into our sources, you'll see that we gather all of our data from national level public sources such as BRFIS data, CDC data, and then our data analysts and our data team really work to kind of whittle it down into the rankings. So it all is derived from that already completely publicly accessible data. So great question though. And I got another question that came in about how can we provide some support for local health departments as they use the website along the way if they have questions. And again, I just wanted to quickly mention that the Contact Us buttons are really helpful. They provide these kind of rapid responses that us coaches can field within a 24-hour to 48-hour cycle to get right back to you. And then those can also evolve into coaching engagements if you want to get deeper into working over time on making some specific changes in your community. So another good question that came in ahead of time.
So I think we need to turn towards wrapping things up. I really want to thank you all for all the questions that you've sent to us. And now we're going to move to the wrap-up. And here you can see that the link to our webinars. Check out our upcoming and archived webinars on our website, this link, and to learn more, you can also sign up for our newsletter. So it's also important in terms of staying connected to use social media to stay in touch with us and communicate about County Health Rankings and Roadmap program. So you see we have Twitter, Facebook, and as I mentioned, here's the link where you can sign up for the newsletter. So don't miss out on the latest news. So we often end our webinars with reflection questions. So we invite you to consider as you leave this webinar to think about who else do you need to share this information with. As you think about all that you've heard today and the resources we've reviewed, who else might enjoy learning or benefit in learning more about it? What's one idea for action that you're taking away from this webinar? And how can you ensure that you put that idea into action? So again, we really want to thank you for your attention and thank you for the work that you're doing in your community to make your community healthier for all. Thank you.